Aye, we give you the facts. It's not what you think. Popeye Newsling, Young King, 1 yard, bless.
Good morning, Popeye. Grandma watch Popeyes every morning and every night.
What am I think? What am I think? You're listening to Popeye News Links. This is the Admiral Tibet who I represent, and remember, the time is so serious, cantankerous and dangerous. This is Popeye News Links.
The first verse of the national anthem, it goes like this. Sing with me. Yeah, man, stand up. Anywhere you are right now, get up and stand up. Stand at attention. You can stand at ease. Eternal Father, bless our land. Guard us with thy mighty hand. Keep us free from evil powers. Be our light through countless hours. To our leaders, great defender, grant true wisdom from above. Justice, truth be ours forever. Jamaica, land we love. Jamaica, 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 land we love. So, here's some sound, you know, when I was singing the chorus. Boom. Good evening, everybody. Good evening, good evening. How do you do? I know we just posted a video, so pause the video. We are going live now. We are going to be getting some important information, and then you can go back and watch the video. So without further ado, because we're going to have Doc for about 45 minutes. Without further ado, Dr. Elliot, how are you doing, sir?
Good afternoon, Mr. Popeye. How are you doing?
Me there, man. Me there. Me good. So this evening we have
Good
some
afternoon.
important. Yeah, man.
Yes, man.
We have
As
two
usual.
important topics this evening. We're gonna talk about migraine, and then we're gonna be
Correct.
touching on menopause, and then we have another topic coming up. But without further ado, Doc, let's get into it because we know we're time limited.
Right. So good afternoon,
One second, Doc.
subscribers.
One second, Doc. And for persons who have any medical questions, please just pay attention to the discussion now. And when we are finished, then we'll be taking the questions. If you type your questions now, we might overlook it. All right? So please, list those. Okay, Doc. Sorry about that.
Yeah, no problem. I know you wanted to just set the ground rules down. So just
Yes,
wanted
sir.
to say good afternoon to everyone again. And welcome. Thank you for listening. Thank you for tuning in. So we had two topics that were requested last time, so we wanted to jump into those. So the first one would be is migraine. So migraine is not just a headache. It's a neurological condition that can be separated into 4 stages, which I'm going to discuss all the 4 stages. And it affects over 12% of the population, which is over 1 billion people. That is quite a lot, and we see it a lot in the practice. So I know a lot of times patients will come to the office and will ask, what are your medical conditions, and they'll say they have migraine, and then our question is, well, my general question and our question would be, did you diagnose yourself or were you diagnosed by a doctor? A lot of the times patients just say, okay, I have a headache, and they diagnose themselves as migraine. So we're going to define migraine and the preferences for a doctor to diagnose it for you. It is a condition that is diagnosed by a doctor because there are certain criteria which I'm going to jump into as well. So we'll talk about the criteria first. It needs to be, for a migraine, you should have had at least 5 attacks in your lifetime. And those 5 attacks include you either have a headache for 4 hours consistently or up to 72 hours, so like 3 days. Right? The other thing that it comes with is it could be one-sided or it could be both-sided of your head. But it definitely comes with throbbing, so that's something else to tick off on the list. It comes with nausea and or vomiting, so that is also a criteria. And then it comes in, you could also have something called, light sensitivity, hearing sensitivity, and newly it actually comes with some touch sensitivity as well, and taste sensitivity. So it could come with any one of those because it does affect your senses, right? Okay. And also, so those are some of your criteria that you really want to look on for a migraine headache, right?
Mhm.
Definitely you want to basically talk to your doctor about it just so you can actually identify those areas. It does come in 4 areas. It doesn't have it come in 4 stages. It doesn't have to be all 4 stages that you see, but in general, it comes with something called a prodrome phase, right?
Mhm.
Or pre-monitoring phase. So that's when like 3 days before you find yourself yawning a lot, you find yourself fatigued, you just find yourself not feeling well, right?
Yes.
Then
Yes.
it can move into something called the aura phase now. So with the aura phase, what happens in the aura phase, you have zigzag lines, you could see black spots, or you just find that things just don't seem right when you look. Flashing lights, that's another thing, right?
Yes.
So that's the aura phase. Now, once you move into the attack phase, now that is when you get those criteria that I talked about, and it is a headache that can preferably put you out, debilitating. So basically, you can't move, you can't function. You just want to stay in the dark. You just don't want to do anything, and that it can seriously put you away from work, put you away from school, and then when that's over, now you have the post-drome phase, and that's when you feel like you're hungover, and that can last another day or two.
Mhm.
There are medications out there that helps. Panadol migraine helps, Excedrin migraine helps, but really, what really helps is some medication called somatotryptin, and again, see your doctor. Sometimes the ibuprofen helps as well, so definitely see your doctor if it's at the point where you cannot manage it and you need some help with managing these symptoms. And the doctor will go through the history and figure out a few things. And the reason why I say we want to look at the history as well, because you can be stimulated, or the headache can be brought on by a few things, or quite a few things actually. Stress is one, right? Lack of
Mhm.
sleep is another. uh, Beverages such as coffee or things that contain caffeine, alcohol including red wine, sometimes milky products, those things can certainly bring on a headache. Those are some of your main things. But smell,
Doc, just a
high
minute, Doc.
smell.
Just a minute. Yes, you just said including red wine.
Yes, man, it can definitely bring on your migraine. Absolutely, it's one of the
Okay.
things that's listed. Yes, man.
Okay.
Um, so it's something to be mindful of. But yes, alcohol can bring it on, and one of the things they list is red wine. Red wine does bring on a migraine headache if you do in fact were or was diagnosed with a migraine headache, right?
Okay.
Um, so those are some of your things that you look for, and in terms of your treatment. So you want to stay away from those, and also weather related. Sometimes high pressure or low pressure can also bring it on. So that is something else to take into consideration as well. So
Mhm.
again, for treatment, lifestyle changes. So if you know those things trigger your migraine, stay away from those. And
Mhm.
again, Panadol migraine, ibuprofen or non-steroidal anti-inflammatories, Excedrin, and also the bigger ones would be the somatotryptin. They're a little on the expensive side, but if that's the route you have to take, then let's do so. So
Mhm.
that's migraine in a nutshell. It is something that needs to be very well, I would say, diagnosed and very well managed, because it does put you in a situation where you just can't function sometimes for days. And sometimes,
Mhm.
if you can tell that it's coming on, like you know that you're in the, the area where it's just about to start, you're seeing those
Mhm.
aura, or you're just starting to have that feeling, then sometimes you can actually go on medication to help. There is some studies out there that says beta blockers can help as well in terms of preventing it from happening, called a prophylaxis. So it is something that we can manage once you have been diagnosed. But again, there are certain criteria that needs to be fit, and once you fit into those, then you take a look at it. Then the other thing that you can also look on with your doctor is it something called chronic migraine or episodic, which means episodic is less than 15 attacks for a month, and then chronic means you're getting more than 15 attacks for the month. And that again, both situations you want to check and see what has been causing it, and see if you can fix those lifestyle changes if necessary, or what's happening. So
Yes.
that is migraine in a nutshell.
You had said
Now,
dairy products that include cheese as well.
yes, man, dairy products, cheese, milk,
Okay.
um, yes, for sure,
Okay.
for sure.
Okay.
And
Okay.
pretty much for a migraine, I named the major ones. A
Mhm.
lot, almost anything can trigger it, because it is a neurological condition. It does Studies have been showing that it's now stemming from the brain stem,
Mhm.
and somewhere around the hypothalamus, and the hypothalamus in the brain controls much of the homeostasis, your temperature regulation, your hormones, and it affects more women than men. And again, that's because hormone is hormone related as well. So it is something that almost anything can trigger, but I just named out some of the main ones that is documented so far.
So can migraine lead to mental illness?
It can lead to depression. It can also, yes, it can. Let me just answer that question. Yes, it can. It can lead to depression. It can lead to anxiety, but the other way around too. Your depression and anxiety can trigger your migraine, and your stress can trigger your migraine.
Okay.
So yes, it can, and vice versa. Absolutely. Absolutely.
Yes. Okay.
Absolutely. All right. So that's migraine in a nutshell. I'm sure if you guys have some other questions, we can go back to it. We'll flip over now to menopause, because I know somebody, well, that was one of the requested topics. So for menopause, it signals the end of the reproductive years for a female. And that could be, in general, when it happens naturally. In the Western world, it happens at about 51 years old, and in the Asian world, it happens at about 49. So it's really 50 plus or minus 5 years in terms of how things happen, right?
Yes.
So what does that mean? It means that you, as a female, you have gone 12 consecutive months of not seeing your period, which means ovulation has stopped, and that says now you are no longer reproductive. Now, prior to that, you have the premenopause, the 2 or 3 years before, where your period stops for a little bit, then it returns, stops for a little bit. Now, menopause is a very difficult condition for some women, because a lot of women will talk about hot flashes where they feel very hot, face, hands, sweating a lot, right? So that happens. Also, what triggers here now, this is where the mental thing comes in, Mr. Papa. A lot of women, when menopause hits, because the hormones have dropped, because the pre-production has stopped, what has happened there now is a lot of times depression kicks in, anxiety kicks in, just mood swings kicks in a lot. And the gentlemen who are the supporting persons around do recognize and understand that it is a difficult condition, and it is something that support her through it. Very, very difficult. Now, the other thing, there are lots of other symptoms that comes. It comes sometimes if you have migraine. Some women experience more migraine, some women experience less migraine, because again, migraine is hormonal based. So now with the hormones starting to change, the body is trying to get back into a system of homeostasis. So it does cause a bit of concerns there in terms of other things being triggered. A lot of times as well, women will gain weight, and sometimes they'll lose weight. So it all depends on which way it goes. But women will definitely say, you know what, I just don't feel well, and they'll have sometimes they'll have a shorter fuse, which means that things that they used to tolerate a lot, they don't tolerate it a lot more, right? And again, it's something that we have to recognize. So those are a lot of the symptoms. There are lots of other symptoms that comes with it. Some women will notice that they have difficulty concentrating. They'll something called brain fog. They'll have these symptoms. They have difficulty remembering stuff. So it is very, very difficult. But recognize that you are there. Look at your age now. It can happen earlier. Now, this is when it happens naturally. So let me talk about it can happen not naturally. For example, if you had to do a surgery and we remove both your ovaries, then that puts you into menopause, and that can put you into menopause much earlier than the natural ages. If you had to do chemotherapy, then that can also put you there as well. So do recognize that those are things that can put you into menopause. And if you are in menopause, then do recognize that you will need some help. Sometimes you'll need help from the psychiatrist, psychology perspective, doing something like cognitive behavior therapy. You might need, we tend to suggest, Evelyn Primrose to basically help. And a lot of times as well, we'll just focus on the symptoms, whatever's happening to you. Let us see if we can actually work on it from there as well. But very difficult. There, outside of Jamaica, there's a lot of hormone replacement therapies. There are pluses and minuses to that. And I suggest you talk to your doctor about it. It's not used a lot in Jamaica because women tend to fight through it, and a lot of times do diet and exercise, very, very big. And as you know, Mr. Papai, we're very big on the diet and exercise, and that helps a lot with menopause and balancing those hormones and helping you through your symptoms that you're going through. But I do know a lot of women, when they come to the office, a lot of the symptoms that they have, we can work through. The most difficult one that I seem to see is the hot flashes, because that one it's very difficult to manage. That one, they'll be sweating when the time is cold and so forth. So something that is very difficult to manage. But menopause, certainly something to recognize. Certainly recognize that if it happens naturally, then yes, it's part of the life progression, and it's something that can be worked through. And I suggest that the partners, men and so forth, you or your partner, just support you through it. Family members, everybody who's around you, just support. Let them know that you are there, and they'll support you through it, because it is a natural part of what happens of the life cycle of us. Okay, so that's menopause in a nutshell. Now,
yeah, what does those men go through anything similar? What they call what? Because I see somebody asking that question. That's why I'm asking you that.
No, I smile. No, in terms of menopause, no, we don't really go through anything as similar as documented from the perspective of where our reproductive years end and our hormones change. What I
Yes.
will mention is that so as you guys might have seen, or we have all seen in the news, a lot of these movie stars have been having kids up in their 70s and 80s. So, and so for us, we don't have a reproductive shut off in terms of that. We can still be able to have kids or get kids very late into our years. We never saw. What happens to us, though, something to mention, is that our testosterone level drops at around 37 years. So when we're about
37?
37, our hormones drop, and that kind of puts us in a situation where I'm not going to say erectile dysfunction, but I'm going to say we don't function as we used to when we were younger sexually.
Yes.
And that kind of puts, so if we want to put something that's similar, I would say that's the more similar thing that happens. And that puts us in a situation where now, that can make us either depressed or not function as well, or have self-esteem issues. So that would be the closest thing when our, I would say, testosterone level drops. And again, that's normal. And what we can do to mitigate that is diet and exercise, right?
Yes.
And as we are on that topic, something else to mention with menopause as well, something that I didn't mention is that, and since we're on the topic, I say, what will happen to the female as well is that there'll be vaginal atrophy, which means that it won't be as lubricated. So that's something else. And again, gel can be used and some hormones can be used in that instance. But to answer your question, there isn't anything documented, but the most similar thing I can think of for men that happens is our level of testosterone dropping, and that now signals us men not being functioning as we used to when we were younger. But to mitigate that, diet, exercise can certainly help on that.
Yes. Okay. All right.
All right.
All right. Go ahead. Yes, sir.
Yeah, no problem. So that's sort of the two topics that were requested, and I know time is always of essence. What I wanted to talk about, as I mentioned to you, Mr. Papa, is just to kind of highlight urgent care medicine and kind of highlight some of the stuff that we do and just put it out there so everyone, because educating everyone about what urgent care medicine is and understanding it so that you can, recognize and see what our facility does from that perspective. Because we're urgent care 360 plus family medicine. So urgent care medicine is a branch of medicine where you need immediate attention but don't require overnight stay at the hospital. So what does that mean? You have a condition that is non-life threatening, but it is time sensitive. You have a laceration that needs suturing. You have abdominal pain that's hurting. You have vomiting, diarrhea, excruciating headache. You have something where something fell on your hand and now it's swollen. You were stung by a centipede and you're in extreme pain. Those are urgent care medicine situations. You have I would suggest if you have a chest pain, come to us and let us figure out whether it is just something simple that you have a muscle strain, or are you now having something like a heart attack, which means now you go to the hospital. So that's what we do. Now, in terms of what we do at our facility, we do a lot of point of care testing, and we also have an ECG. So we tend to do, if you have a chest pain, depending on where it is and when it started, most likely you'll get an ECG. In terms of rapid tests and stuff that we do, we can do CBC, which is complete blood count, and it works well, especially now we're going into school medicals. Because school medicals, which we're doing, from Monday to Friday, 9 to 5 in regular hours. You can do it outside of that hours, but of course, surcharges and urgent care medicine fees apply. But however, we do CBC because a lot of times, a lot of the schools require, especially going into first year, your complete blood count. We can do that on the spot in 10 minutes from a finger prick sample, which is phenomenal. The next thing that we have on site that helps us phenomenally, and we might start seeing a lot more cases, is we can do a dengue rapid test for you on the spot, know your results in like 10 to 15 minutes. And that helps us now to manage you accordingly, right? We also do HIV, syphilis, those tests as well. So those are quick point of care tests. Something that is we added recently and really helps us is, for example, you did executive blood test, and we recognize that your HbA1c is higher, your cholesterol is high. A lot of times we can repeat those tests for you in-house, depending on how fast we want to get it. A lot of times we'll send you back to the lab to make sure we're comparing apples to apples. But we can also do that in-house to see your progression, just to make sure that the speed limit and so forth, we're starting to make some progress on that as well. So we do have that rapid test in-house. But we did branch wider and wanted to mention that we do genetic testing as well. And the beauty about the genetic testing that we do, if somebody wants to find out, if it's their child and so forth, the child or the dad can be in Jamaica and the child can be in the US, Canada, US, or should I say US, Canada, UK, almost anywhere in the world, and we can still put that together. You just need to call the office and we will basically sort out what we need to do and collect the samples in-house, and then we can collect the samples wherever they're at that location and put those together. So we have started that recently. We've partnered with 876 DNA Test, phenomenal company, great customer service, and we're basically working with them with that as well. So it works phenomenally. Come into the office or you can call them. Either way, we can get that testing done.
Hold on, Doc. Hold on. Doc, hold on. That, what you just said a while ago, is very, very. I never know that. So somebody want to know if I feed them child that them can come to you and the test is done.
Absolutely, sir. That's the kind of thing that we do.
I'm thinking things like that happen in Kingston or Montego Bay. I never know you offer that service.
Yes, man. We started it recently, sir. You and I need to sit down, and what I need to do with you is I'm gonna sit down and outline all the stuff that we do.
Yeah, man. You catch me off guard a while ago.
But I will sit down with you and show you all the things that you can attest to us doing, which is what I wanted to talk to about next, is our physiotherapy. You can attest to that.
Yes,
right.
Yes.
Something else that we brought in is that we brought in a physiotherapist, because what we recognized was that a lot of people have back pain or arthritis. We have a lot of people who have been recovering from stroke, and physiotherapy works phenomenally with medication to mitigate or even take away a lot of that pain. And one of the things that we do, as you know, is diet, exercise, and physiotherapy is just part of that as well. And so you have now recognized that we're doing stuff that a lot of other locations or other things haven't been doing or haven't done, and we're bringing this to the western side of Jamaica. We prefer not to be in the Kingston. Nothing wrong with being in the Kingston anymore, but we want to be in this side so that we don't have to travel as far to get these kind of things done. Yes. So that's one of the things we're pushing to do.
And you accept all the health cards?
We accept all health cards, absolutely.
Okay.
Absolutely.
Okay.
Absolutely. So those are some of the things, and like I said, I'll sit down with you and we'll go through every single one
man.
of our
yeah, man. I need to know.
Yes, man, absolutely. And the other thing that we have on board right now are not the big on our list, and something that we want to tackle. As I've mentioned before, and I'll continue to mention, stroke is the number one, I would say, cause of death in Jamaica, right? And we have now, and we had him on board for a long time, but we were now basically ensuring that the rest of the world knows that he's with us. We have a very, very, very phenomenal neurosurgeon with us. And we refer pretty much all of our patients to him, and he's been doing an excellent job. So now we have neurosurgery on board. We had it before, but we're now pushing it a lot, because the service offerings that we have dermatology, which happens at the facility. That's through an appointment. We have pediatrics. We have day surgeries. So again, those are by appointments. And day surgeries, keloid removals, lumpectomies, We did hernia repairs, not so much now, but we are starting to see if we can actually bring back hernia repairs back in office, because that can be done locally. And also now, like I said, we have physiotherapy on board on site. And now we are pushing to ensure that everybody knows we have a neurosurgeon, so the neurosurgeon can tackle anything along the spine, anything that happens in the brain, and those. So those are things, and we're looking to add more stuff in the pipeline as we continue to grow. The idea is to bring a lot of the medicine that you would get in the other, I would say, bigger cities to the western side of Jamaica. So we don't have to travel as far. We can have it right here in this vicinity, in this, I would say, the Cornwall County. So anywhere from Trelawney, St. James, Hanover, Westmoreland, and St. Elizabeth, we have this kind of medical care set up in SAV. Right, so that's what I wanted to highlight, and I wanted to highlight these are the things that we can do in terms of, we also, if necessary, and we have done this, we don't typically do overnight stays, but if we have to, for example, if we have to keep somebody overnight because they're on IV fluids, or we need to monitor them overnight, then we can certainly do so. We have a fee attached to that, but we have done it, and we do it as well. So those are some things that we can offer within, and we have done where we actually had somebody long term. We had them for about maybe 5 days, and they needed dressing change and so forth, and we kept them. So we can make adjustments based on what's needed, because we want to offer that level of service, and we can, and we have the level of expertise to do so. So that's what I wanted to ensure that everyone knows, what urgent care medicine. Now, of course, we do the family medicine stuff, and that's done in the regular hours as well. So that's, coming in, repeat your prescription, looking at the asthma, just overall checkup. That's done in the regular hours. But in terms of the urgent care, absolutely, motor vehicle accidents that you need a checkup for. And once it's not a displaced factor, meaning that nothing that's vividly broken, bone sticking up, we can tackle that. If you have a puncture wound, laceration, suture that, get it up and running. Dressing changes, we do all that as well. And with school medicals coming up, just want to say it's now school medical times. We've been starting to see school medicals. We do a lot of school medicals. We're up and running, ready to go for school medical. We're ready all the time, but we have a specific setup. My staff is fully trained. We've been doing this from our starting. We have started with doing school medicals, so we're very well seasoned in handling school medicals. And the beauty about it is that we can also do the CBC, which is a complete blood count, which a lot of schools ask for. We can do it on the spot. You have your results. You don't have to go away and return at a cost, of course, right? So those are kind of things that we do. So I wanted to outline that and just outline what urgent care medicine is. Like I said, it is something that you have a non-life-threatening condition, but it does need to be dealt with in a short time period, and it is something that needs pretty much immediate attention. But you don't need to be at the hospital. You don't need to be, I would say, admitted to the hospital. And I remember mentioning one of our episodes that a lot, and studies have shown this, a lot of the cases that are treated at the hospital could have been treated at an urgent care. I think the study said up to 50% of patients at the hospital can be treated in an urgent care. And we see that. I mean, when you're triaged and you get a lower number, you're not seen till 2-3 o'clock in the morning. That means you could have been seen and taken care of at an urgent care. Okay? Yeah, and we are a urgent care facility. Which
that's why the hospitals are overrun. Yeah.
Absolutely.
African Queen, you were asking where in Sav is the office. It's on Beckford Plaza, where Bromelia House and Shoppers Fair are. And Juicy Patty, right behind Juicy Patty. You enter the plaza, you go in and you make that left turn upstairs. You can't miss it. Upstairs. Somebody was asking at what one second. Somebody was asking at what age did the doctor say women normally start menopause? Menopause, I think he said plus 50 or minus 50 years old.
Right. So it's for the Western world, it is 51 years old on average, and for the Asian world, it is 49. So on average, it is 50 plus or minus 5 years in general.
Yes.
Right. So once you reach 50, you can start looking around to say, okay, what is happening? So 45 to 55. Some women are earlier than that, and some women are later than that.
Yes.
But the average is 51 for the Western world. For the Asian world, which is more Eastern, it is 49.
Yes. I'm just looking. Yeah, so African Queen is on Beckford Plaza in Savla, where the bus park is now, because they moved the bus park. It's right across from the bus park, upstairs. All right, just
And I'm
go.
glad you
Yes.
I'm glad you said that, Mr. Popeye. When you're at the bus park, you can look straight across. You'll see that big sign right
Yes.
on the wall that says
Yes.
urgent care medicine, and it has a telephone number. We are upstairs. Literally, you walk right across from the bus park. No, the no bus park.
I don't know if you want to discuss numbers, but I see a few people asking about the cost for the DNA testing.
I would prefer not to, because
Yes.
we record it, and when we do this 10 years from now, we prefer not to have the numbers there. What
Yes.
I would suggest is call the number that is there, the 876
95.
954
Yes.
0653, which is our office number, and let's
Yes.
discuss it. Because the number that we're going to tell you today
Might change next
will
week.
change based on inflation, based on things going up. But
Yes.
call the office. At that time, you can discuss a few more. Rather than just telling you the cost, you can discuss, because the couple of things, what I will mention though, is there is a 15 calendar day service, and there is a 4 business day service. So you can discuss that. And both prices are below where the other prices are in general. But that's what I would say there to pique your interest. But absolutely, call the office. The office can give you all the information there, and you can also talk about scheduling and all that. But I would suggest call the office, because again, this is dynamic. Life is dynamic. Things change, pricing change, and we don't want to put one price and then you say, oh well, a doctor did say on this at this time, because things will change, right? But contact the office and they can give you the most current of the price. But what I can tell you is that there are 2 very good services: 15 calendar days and 4 business days, which means that doesn't count the weekend. But that means if you're going on up, drop it off, get your sample done on say the Monday, you can get it by the Friday. If it's on the weekend, now you have to count the weekend, don't minus the weekend, but it's business days, right?
Yes, sir. Somebody asking, can period come back after 12 months? And another question was, can a female during their menopause get pregnant?
During the menopause, get pregnant? No. And to answer the other question, will the period return after the 12 months? There is a saying in medical school or in the doctor: if you see your period during menopause, find your doctor immediately. We normally say it is endometrial cancer until proven otherwise. So if you are in menopause, you have gone 12 consecutive months of not seeing your period, and all of a sudden you see your period, go straight to your doctor immediately, because it needs to be investigated. And as I said, in medical school or within the doctor fraternity, it is endometrial cancer until proven otherwise, meaning once you have entered into your menopause and you've seen some period, something is going on. It could be other things too. It could be something brewing in terms of cervical cancer. Could be anything, but it should not return after you have entered into menopause. A period after that requires urgent medical attention. Do not sit and watch it, because it is not normal. 12 months in, not seeing it, you've entered menopause, you see it again, absolutely investigations. Most likely, doctor will do an ultrasound, and maybe you have to go in and do some other things, biopsy, that kind of thing, just to make sure there isn't anything going on. Okay?
Yes.
Very, very serious.
Steph, I think that should answer your question. You were asking how long does menopause last for? I think that your question was just answered. Okay. I'm just looking at the question. What about? One second. Let me just.
No problem.
I think you answered it. Somebody was asking. I think you said it before, but somebody's asking what's the difference between premenopause and menopause.
Right. Premenopause is when you're still seeing your period, but it actually isn't that full consecutive 12 months of not seeing it. So you'll see your period, you might miss it for a couple months, 2-3 months, and then you'll see it again, and then you miss it for 2-3 months. And in the premenopausal period, you can start having those symptoms which we talked about. When you're in menopause, the period is done. You are no longer reproductive. You no longer are ovulating, because when you have your period, it means that you have, well, that means you didn't get fertilized, but it means that you're ovulated, right? Once you have entered into menopause, you are no longer in your fertile period. no longer able to basically have children naturally because you have ovulated.
Okay. Okay. Any other questions? You can ask a question now. Mabali, you were asking how expensive is a biopsy. I don't know if you want to tackle that, Doc.
And again, remember, I prefer not to give price because again, the thing is, we don't do biopsy. If we realize something is happening, then we do an ultrasound and so forth. Meaning, send you to do an ultrasound, or we suspect something else, we will send you to the obstetrician gynecologist, and they will have their own prices. They will have their own setup, right? And we
Mm-hmm.
have done that. We have seen where women have they're in their menopause, and they came and said, "Doc, I'm starting to see my period," and we have sent them immediately to their obstetrician gynecologist period, and they have done their biopsies in some cases, and we take it from there. There was one instance where we did the ultrasound, and we recognized that it was suspicious of a cancer that was there, and we sent them out to the obstetrician. But again, prefer not to give prices because depending on which gynecologist you go to and how they're set up, they'll have their own prices. And I remember what I said today. The price will be one thing, and next week or 2 weeks later, it might be something else. And as life progresses, this is recorded, so I would like it to be more as current as it can. And the best thing to do is to contact your doctor at the time and have the prices for that time period given to you.
Yes, yes. Um, Somebody's asking about the name of your neurologist at the facility. No.
Oh, the neurologist that we use, we all right. So the thing about that now is Dr. Hamilton. He is the neurologist. He is out of Cornwall, or should I say St. James, and
Yes,
he consults with us, and necessarily he comes up to us in instances. Um, but do remember that again, we are very dynamic, right? So that's the neurologist we have on board right now. If things happen and we need to bring on a second neurologist, absolutely. We consult with other neurologists as well. So we also have Dr. Patton, who we consult with, and he is out of Kingston. But the neurologist that we use right now for urgent care 360 is Dr. Hamilton, and he is one of the persons that we refer a lot of our patients to. Absolutely amazing, absolutely. He very, very much follows up on the patient. We have a very good relationship in terms of both of us are on the same kind of urgency, getting things done, making sure that we follow up on our patient very consistently. And that's the doctor that we use for our neurosurgery and neurosurgical consults. And that's where we send our patients because we are down on this section of the world, right?
yes,
So
yes.
that's the neurologist that we use, or that's the name of the neurologist that we use.
All right, write this down, Doc. Somebody's asking that we discuss fibroids and endometrio
Endometriosis.
endometriosis. Yes.
Um,
So
absolutely,
fibroids and endometriosis. So we
absolutely.
can, yeah, we can look at those.
No,
Somebody keep asking
we,
how long does menopause last? But it is permanent, right?
yes, it is. Yes, it is. I was about to. I remember when somebody asked that, and it is a time period that is permanent. Once you've entered into menopause, you are no, that is permanent. You're in menopause and you won't get out. That is it. You're no longer reproductive, no longer having any ovulation happening. So once you've entered that, that is permanent.
Okay. Can insomnia be treated?
Yes and no, and I say yes and no because it depends on. So insomnia is a very complex condition as well because what happens there is that you sleep but you don't feel like you've slept well. And one of the things that sleep studies, there are sleep studies out there. Some people can sleep for 5 minutes and they feel like they're fully rested, where some people sleep the whole night and don't feel like they're rested. So insomnia
Mhm.
is more of where you sleep and don't feel like you're rested, or you have trouble falling asleep, or when you do fall asleep, you wake up early. That can be a symptom of a lot of things. It can be anxiety, can be depression, even though depressive people tend to want to sleep a lot longer, but it can also throw off your sleep patterns. It can also be hormonal changes, right? It can also be a diet. It can overall be stress. It can just be a lack of exercise. It can be all those combination all together. So yes, it can be treated depending on what starts it. Now, some people have insomnia for a very long time, and that makes it a bit more difficult to treat. And treat meaning treat, fix it, and so that you don't have to be on medication, right? Sometimes some people need to be on medication to help them to sleep. One of the things that happens in insomnia, as you know, research have shown, is that your biotic clock is a bit off. And one thing that happens as we get older, so when you're younger, you can sleep all day, and your body produces melatonin, and melatonin helps you to shut down. So you close your doors, turn off your lights and so forth, turn off your television, turn off your phone, and once it's dark, your body starts producing melatonin, and your melatonin shuts down everything so that you go to sleep. So that's one of the reasons why we tell a lot of people when you're about to go to sleep, in the office that is, we say, if you want to go to 10:30, by 10 o'clock you should have shut off the TV. Don't let the TV put you to bed. Turn off the TV, turn off the phone, don't be on your WhatsApp, don't be on all those other social media stuff. Turn them off, turn off the lights, be in the dark, so your body can naturally go in and shut you down by producing this melatonin, right?
Mm-hmm.
As we get older, our level of melatonin that we produce gets less. So that's one of the reasons why when you're younger, you can sleep all day. And as you get older, you feel like you don't need as much sleep. You can sleep, you can function on maybe 6 hours of sleep and you feel well rested. Now, sometimes in insomnia, that melatonin shuts down, and instead of keeping you asleep or making you function well, you sleep for only 2 hours and you're back up. Now, insomnia becomes a problem when you wake up and you become anxious about being up, rather than saying, okay, am I up? Can I function? And use that time and basically go back to bed, or do some exercises. So it's a lot of those things. The other thing that you also have to look on is, did you go to bed at 7 o'clock and now you're waking up at like 3 o'clock in the morning, right? So if you went to bed at 7, you wake up at 3, that's 8 hours of sleep. So that's really not insomnia, but you're waking up a little too early than you want. So try and shift your time further. You go to bed at 10 and maybe wake up at 5 or 6, right? So those are things, but it can be treated for the most part. But sometimes if it's there a bit longer and there are other things that cause it to have insomnia, it could be neurological, it could be because you had a stroke. It's very, very one of those that you should go into your doctor's office, have a conversation with your doctor, come and talk to us, and we can help you through that for sure, in terms of telling you which way you can go, and helping you through it as best as we can. There are some drugs out there called the Z drugs, right? So that class of drugs helps you to sleep and helps you to reset your biotic clock without putting you at risk of becoming addicted to the medication. I did mention about benzodiazepine now in one of the other episodes, and benzodiazepines, if you take it too long to help you to sleep or help you with anxiety and sleep, you can become addicted if you stay on it too long. So we usually prescribe it for 2 weeks, and that helps you to sleep and takes away anxiety. But after that, we take you off it because you can become addicted. Now, with the Z drugs, no, you don't become addicted, and we can keep you on it as long as we need to basically get your biotic clock functioning as best as we can. There was another study out there, and I had basically added this to my regime as best as I could. What they found was that people who went to bed around the same time, or should I say wake up at the same time and try to get as much sleep as possible, 78 hours, they found that they function at a higher level and they were able to keep their times that they wake up. They didn't need clocks to wake up in most instances because they were waking up at the same time, even on the weekends. Because one of the things, or on the days off, because what happens is on your weekend, you throw off your biotic clock, or on the days you're off, because you slept in, you throw off your biotic clock. So when you're ready to go back to work, you feel groggy. So again, those are things. Traveling in time zones as well can throw off your biotic clock. But the key is with insomnia or with sleep pattern is to get it to a level of consistency and continuously doing the same thing over and over, and your body becomes into a rhythm and into a habit that it doesn't need anything more than to function. Diet, exercise absolutely helps as well with that. You can get melatonin in the pharmacy as well. Some people it works for, some people it doesn't. You don't take it too long because again, studies show that you shouldn't take it too long. But you can try that. If that doesn't work, find a doctor, or just find your doctor in the beginning. but it can be helped, it can be worked on, and for the most part, what we have seen a lot of success with it, but it does come with finding the root cause of it and then fixing it from there.
Yes, yes, yes. Our final question. Somebody was asking, once if someone remove their uterus, how long?
Right.
How does that person know that they reach menopause stage?
So removing your uterus doesn't mean you removed your ovaries, and a lot
Okay.
of times you can do a subtotal abdominal hysterectomy, and that keeps in your ovaries. And a lot of times doctors will remove one ovary and don't remove the second one just to prevent you from going into menopause. So what you will need to do there is to talk to your surgeon, your gynecologist, and find out from them what was done. All surgeons and doctors will have done their medical notes and write up their procedure notes, and they will write down what they did, so that 7 years, 10 years from now, they can look back. You can go back and say, doc, what was happening? And the doc can look back and say, okay, we did your surgery on this day, and based on my notes, this is what was done. Right? So the best way to find out is to find out from your doctor what was done, because you can't just say, oh, he didn't remove them or he did. Now, of course, you'll find some symptoms going, but removing your uterus doesn't mean he took out your ovaries, right? So that's
Okay.
a different part of the anatomy as well, right? But
Okay.
the best thing to do is to talk to the surgeon, talk to the doctor that did it, your gynecologist, your OBGYN, talk to them, find out what was done, find out why they did what they did, and they would have most likely talked to you about this, because I'm going to tell you, we as doctors prefer you not to go into menopause before the time is right, meaning before it naturally, because it can become very difficult, right? Unless we have to remove those ovaries. Okay?
I know we are time that, but there's a lady saying that she's 54 years old and she's still seeing her regular period. Can she get
Right.
pregnant?
Absolutely.
Yeah.
100%. And we have seen that. We have seen women in their 50s get pregnant. You're
Yes.
still ovulating. You're still seeing your period, which means you are still ovulating. So you still have to use protection.
Okay. 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 54. Well.
Yes, sir. It can still be
Yeah.
done until you have reached menopause. 12 consecutive months of not seeing your period, you are still in your reproductive years, and that means there is still a chance for you to become pregnant.
Yes.
Right? Right.
Yes.
Now it will
HRT.
depend.
What are the stats on HRT, especially linking to breast cancer?
There are studies out there that links it to breast cancer. There are studies out there that don't. That's a
Mhm.
separate topic on its own. But
Yes.
it
Yes.
is a safe way to go about it. But you should sit down and talk with your doctor about it and look at the pros and cons. Used a lot in the I would say the first world countries, Canada, US, and
Mm.
there are pluses and minuses to it. There are studies out there that linked it to it. There are studies out there that didn't link it. And do remember, there is always that chance that something can happen. But talk to your doctor and look at it from a plus and minus standpoint of things. Don't just take it as face value. Yes, it's linked to breast cancer. Yes, it's not. But it does show that some studies have shown that yes, it does put you at more at risk. But there are lots of things that put you more at risk of getting a lot of other things. So is it worth the risk or not, depending on your symptom? Is it something that you would prefer to say, okay, let me take a chance, monitor myself for breast cancer, but also because of this, because I have so many issues I want to go on it. Something to
Yes.
be discussed with your doctor. Absolutely.
Well,
And
Doc. Well,
Mr. Papa, this has been a great, but we're now 4 minutes
yeah,
over.
man, we gone over time and we know how the thing said. So we'll be back
Absolutely, sir.
either next week or the other week, right?
Yes, either next week or the following week. We will discuss.
Yes.
And most likely next week, because we missed last week. I mean,
Yes.
last month, we're trying to make up. We're giving
For,
2 episodes this month to make up for that to our viewers and subscribers.
okay.
So, our apologies for that. It was just a time scheduling. So, we're doing 2 episodes this month, either next week
Yes.
or the week to make up for the fact that we didn't do one last month. And we
All
gave
right, Doc.
you 4 minutes based on that, but now I have to run. So I know you'll
Yeah, man.
continue your
We're in
discussion.
a fast, so take time. You hear, Doc?
Yes, sir. Okay, viewers, subscribers, and I want to say shout out and say thank you for everyone who has been coming to our facility, Mr. Popeye. We have gotten quite a few patience from doing this and from your channel. So thank you. We want to say hello to everyone that is outside of Jamaica as well. We do have patients who are outside of Jamaica who have returned and come to Jamaica and come to our facility. So I want to say thank you for that as well. Who hasn't come yet, do try and check us out and basically get some of the urgent care 360 experience and recognize that we do things a lot different in terms of following you up, and we take a lot of time to make sure we give you the best care and we give you evidence-based medicine. And Mr. Papa, I can attest to that as well.
Definitely,
Okay,
sir.
thank you very much.
Enough respect, that. Enough respect. Enough
Yes,
respect.
okay. All right, bye-bye.
Yeah, man. So that was it. That was it. Thanks for joining. I tell you, I'm sure, like myself, a lot of us, we are learning a whole heap. We are learning a lot. Very, very informative, And I would recommend you if to go to urgent care 360 plus family medicine. Trust me, Trust me, you'll be well taken care of, Go there, go do it. Any test what you want to do. Go there. And we did a live stream for Mother's Day. So we are definitely planning on doing one for Father's Day. So we want the Father's Day greetings them come out. Same like how you were sending the Mother's Day greetings. So next week, Sunday, that's what, the 16th, 16th. We'll be here for Father's Day for a live stream. Maybe we do one Sunday because we are scheduled. Well, I spoke with somebody. We are scheduled to talk to her. We are planning on bringing on a mental health care person. We are hoping to do it Sunday evening because I know that mental health care is very, very important. I don't want to have that discussion. So we are planning on bringing on someone to do a mental health care discussion. Hopefully, we are trying to get the person for Sunday, but the person might be traveling. So let's see how that goes. All right, but you will be informed. And once again, thank you. Yeah, Cat B. Yeah, man. We will talk to that about that. We will talk to that about that. Fibroids and I can't pronounce the last word. But we posted that video not too long, and you can go and watch it now. And we are trying our best to drop the birthday greetings by 7 o'clock in the mornings. And that is why we are asking if you have any birthday greetings to send it by 6 o'clock. So if your greetings was not sent by 6 o'clock, it is likely that it will not be broadcast tomorrow. We don't want you send the greetings for today, for next week. Why send it today for tomorrow? So, not because you are going to forget, you are going to send it for now for next week. You are going to be inconveniencing us. So you might not see your greetings. So you try and remember and send it today for tomorrow. If you send it otherwise, it is likely that you're not going to see it. I hope you understand. So, bless upon yourself. Marvally, I have a bone to pick at you. I see you write something. Let me find what you write up here. So, Marvally, I was reading the comments, Marvally, and let me find your comments because I'm gonna put you on blast, I'm going to put you on the screen. What did Marvally say up here? So hold on there, make I find it. I'm looking for your comment, Marvally. Marvally, what is that? Marvally, what that me I see on my screen? 50 we stop doing what? Marvally, what is that I am seeing on my screen? 50 we stop doing what? Marvally, what that? Marvally, what is that I am seeing on my screen? Eh? You think me never see it? Marvally. Steph, what you talk about that true? Is Steph? What you mean by it is true? True, say what? At 50, we stop doing that? Eh? Steph, what you mean by that true? What you say, menopause cause it? What you say? Eh, what you say? Eh, I understand that. When you say menopause cause that? Eh. Okay, I get you. I get you. I get you. I get. So at menopause, when you say after menopause, there's no more feelings. There's no more feelings after menopause. Well, I didn't know that. Where's a cat be? Good call out. But Marvally, you know, if you say I, where I talk about we. Where you say most of us? Steph, where you say for most of us? Eh? And then you know, say, say, I should say, what's her name? I missed her name, but she's saying that she's 54 and she's still a CR period. Eh? She can give her mother a grandbaby at 54, you know. Eh? At, where say menopause cause you not to want it anymore? Eh? The man have to be good. Marvalia, what you say? Hi, Laurel Gilbert. Bless up yourself. Brown eyes, you agree with Mavali? You agree, say what? The man have to be good? Or at 50 we stop? Or what you agree with? The man have to be good? Or at 50 you stop? I want to say, Kirk. Gotcha, estrogen drop Popeye, so no feeling for salt anymore. Blame it on menopause. Eh? Cause you want it more. You read it wrong. Okay, Angela, I hear you. Where you say yes, both brown eyes. So the man have to be good, and at 50 you don't want it no more. Okay. Yes, Sharon, that may I say for some. Talk for yourself. Empress B, what you mean by good thing you stop? Stop the what? You lock shop, Empress B? Empress B, you lock shop? Empress B, where you see you lock shop? I hear you. Chantal, you don't say nothing. Ah, boy. Lisa McLean, of course what? Of course what, Lisa? Avis Allen, bless up yourself. Where you say too fertile, Empress B? I hear you. Oh, I see. I see. I see. I see. God's child, I am 47 and I lock shop and dash with the key. 4 years now. So from you are 43, you lock the shop? God's child, you are 43, shop lock? What you say? Eh? So you're Rasta, you know. You say I tell to your thing, no more salt. From your 43, your I tell is the way to go. Mr. Delores, Mr. 14 Delores. Yeah, man, enough respect, man, enough respect. I hear you. God's child, I hear you. Loud and clear. Loud and clear. So, I'm going to go and start out the birthday greetings, you know. So, tomorrow, yeah, Cat B, yeah, man, it's always good for talk, you know. Better joke, when I say joke, better than quarrel. And we have to have a sense of humor based on what go on nowadays, you know. We have to ensure we can smile when we can, you know. Yeah, man. Where you say Avis, grimy out a road. A grimy you call it, Avis. Where you say mucky out there. Why, oh boy. Bridget, I just turned 49 and my shop just open. Where you see a shop wide open. Bridget, Lisa, where you say Monday your birthday? Lisa, please send me a reminder on Saturday. Here, Lisa? Send me a reminder on Saturday, please. Please, please. And thanks. Send me a reminder Saturday. All right? Yep, yeah, man. I know you said Sunday, you know, it's your birthday, but I'm saying you should send me a reminder on Saturday. Because Saturday is when I prepare the birthday greetings for Sunday. So, like you know, I'm gonna be preparing the birthday greetings for tomorrow. Well, it started already. So that is why I ask people to send in the greetings by 6. All right? This is so refreshing. We have come a long way. This wouldn't have been discussed years ago. God's child, you know, I'm not afraid to discuss any topic at all, you know. No topic is taboo as far as I am concerned, you know. At my age and stage in our life, I am not afraid of discussing any topic at all. None whatsoever. I might not agree with the subject, but I am not and my viewers and subscribers, I have a video to drop tomorrow. It's gonna be about 46 about 46 minutes long. It's gonna be long. But I spoke to a gentleman today, you see? I talked to a gentleman today. Marvelly, my anniversary is Saturday, even though my condolences, Marvelly, boy, my condolences. That was last month, right, Marvelly? My condolences. But I was saying, I'm going to be dropping a video tomorrow. And at first, the conversation is going to sound boring to you. But I implore you to listen it. Listen it. There's a man. You're going to hear what a female did to him and how that female almost killed him. You're not gonna want to miss. You're not gonna miss the interview, yeah. Remember me tell you. I'll drop it tomorrow. Listen out for it. Listen out for it. When you say lie, she needs to talk for herself. Watch Goody come out now. Watch Goody come out. When you say lie, she needs to talk for herself. Walk out, Goody. Lie say. Mabali. Lie say. You need to talk for yourself. Mabali. Boy, I mean, yeah. You understand now, Angela? Hey, Angela, you understand now, all right? I know, you know, but I never want touch, I never want say anything, you know, but she said it. But Goody come out, man. Goody lie, say, you need to talk for yourself. She know in the 50 and stop and lock shop business. Eh? Where you say lie? You know in the lock shop business. Now we understand your sex position, your position and sex. Go on, everything. Go on, everything. Yeah, definitely. We there, man. We there, man. We there upon the we there upon the hillside. And Jamaicans, we'll get some rain, you know. We see the rain start already. We'll go get some rains. So please try and stay dry. If you're like me, a sick fowl as rain wet me start cough and all these things, stay out of the rain. I don't know. I need to start pay attention more to my vitamin C. But if you're like me, stay out of the rain. No man, he just died and I did lockdown long time. Mabali, where you call long time? Where you call long time, Mabali? Mabali, where you call long time? Mabali? Like what? About 10 years? Like how? About 10 years? Sunday is my birthday. Kirk, like you were. Kirk, make sure you send one message Saturday, yeah? Mavali, about 10 years. Mavali, then our 6 days, so. Mavali, our 6 day. That's how I feel like it from about 10 years ago. Mavali? Our. We need to have a private talk, Mavali. That means you know, I miss out on nothing because it was like 10 years before he passed. Mavali? Well, to each his own. Yeah, you have your reasons, and we can't judge you. We can't. Me not go try to judge nobody or be judgmental as to why somebody do what them do. Everybody have them own. I am 54, Mavali. You are 54. You and I are the same age, Mavali, and you are telling me say 10 years ago when I was 44 and you were 44, you lock shop, Mavali. Peter Gay. Peter Gay. Peter Gay says she want lock shop much less. But you can't lock it, not true, Peter Gay. You just can't lock it. Angela, they not read what Mavali say. Angela. Mavali say she locked shop 10 years ago. You're not reading? So, and it's not just since recently. She said she locked shop 10 years ago. That's what Mavali said. When she was 44, she locked shop. Peter Gay, you go on, you know, but you want lock shop. Eh? And that she said, Angela, Papa, it look like I saw me. I go back to God. This 32-year-old coming in my DM, I had to tell him to look the other way. No young boy to me thing. So God's child, you know want an old man, and you know want a young boy. How what you want? Eh? Because if the man was like 50 odd, you would have said you don't want an old boy in your DM. Angela, when you say maybe Marvally got too much, I say in between. Marvally say in between. All right, I hear you. No old man, bro. You go on, Angela. Anyhow, we're going over. Oh, you know, I mean, I love run the live them so long. But let me tell you something. You see, the next live that I'm gonna be doing, not the next live that I'm gonna be doing, but I have a live coming up because I'm going back to revisit Chantal Blake McCullough and Shane McCullough, because Shane think him get way. I understand Shane moved the business from Old Harbour to Manchester or St. Elizabeth. We have all foot. You know what? Shane McCullough, we are gonna be tackling him next. Yeah, man. We are coming with, we are gathering all of the information. We are gathering the information. So look out for that. Once again, thank you for joining. It was a spirited discussion. Love you no bad. Bless up on yourself. Yeah, man, the live can replay. The live will be on the channel. So in about after when the live ends in about 2 minutes time, you can go back and watch it. Slicky and a killer in their jail, you know. Slicky and a killer, Russia and Patterson. In their jail, the judge had remanded him in custody. So the judge had said no bail until trial. So in their jail, I wait for him trial. Right? And you know about the teacher who was found, her skeletal remain. But nobody miss out on something, you know. Because I see them blaming an driver. But I have something coming up. Because we know who they are jail, and we know our relationship, the person where they are jail had with the teacher. And it's not big, but you know what? Be that as it may. Bless upon yourself. Thanks for joining. Enough respect. Love uno. Enough respect. Blessed love, everybody.